To open
It's
a
free of
premium account
corona,
with
you know.
exciting possibilities, dial 01-236-7715 or 0700-7768-4387. Providus Bank. Future Forward Banking. Providus Bank. Future Forward Banking. You know you're listening in on this frequency. We are. It's not a question of clear signal. It's not a question of quality sounds.
Love music. Love life. Love life.
It's never a question of engaging intelligent discourse.
This is democratizing beyond democracy. Very quickly, your thoughts.
I disagree absolutely. Proceed.
Final stories.
Please, how do you pronounce your surname?
Sam Sedi.
Sam Sedi, okay. Is it okay we call you John?
John is beautiful.
Okay.
Dr. John.
You don't use title.
Be a
Yeah,
question
we don't use title.
about who we are.
Okay. Okay.
We
Okay.
are
Yeah, which one is that?
Dr. John. Dr. Lawrence. Okay, that's fine. Okay. Studio is live, mics are up, studio silence please, phones on silent please. Good morning, so glad to know you're still there, listening to Smooth 98.1, your love music, love life radio station. This is Valentine.
And I'm Ayo Myro Essay. Good morning, Lagos.
Good morning. It's time for, this is the final segment for Smooth Breakfast and one of the most interesting segments for Wednesday. It's a special. A special presentation will be centered around conversations on glaucoma. We had this conversation, it feels like yesterday, but we had the similar conversation last week around glaucoma. We have guests, favorite people in the studio.
Yes.
Please do the honors.
All right, Lagos, get ready. As we mentioned, we are going to be focusing on this condition, and it's important because I wouldn't let the cat out of the bag. As we continue our conversation, you'll understand why it's important that we sensitize the public on this on a regular basis. And to join us for this conversation, like Valentine mentioned, favorite people, we have Dr. Modukbe Olonimbe, chairperson, Lagos State branch of the Ophthalmological Society of Nigeria. I had the tongue twisted there. Good morning, Mom. Good to have you on the show.
Thank you for having me.
Thank you very much for coming. And we also have joining us Dr. John Samsedi, who is the chairman of the Lagos State branch of Nigerian Optometrists Association. Good morning.
Good morning. Thanks for having me.
Thank you
Good
for
to have
joining
you.
us.
Now, today, the focus of our conversation for Lagos Talks 981 is how to beat invincible glaucoma. We're going to be talking about this, and whilst our experts speak on this topic, would encourage you to please send in any message you have, questions, concerns, areas that the gray areas that you'd like to throw more light on, pun intended, and just let us know what you would want our experts to discuss on this morning. It is Lagos Talks, and we would love to hear you give us feedback, give us your thoughts and reactions. If you'd like to do this, send your message to WhatsApp. WhatsApp number is 0809 444 0981. On YouTube, we're streaming live as we do for our special. So go to YouTube channel, Smooth 981 FM Lagos. And of course, on Twitter, you can send your message through that platform.
Use that hashtag Lagos Talks 981. We encourage you to send comments because it's a conversation that largely depends on you. Dr. Lauren, the last time I like how, and the last time being last year, sorry.
It
I
feels
honestly
like
said
just
last week. Yeah,
yesterday.
it just feels like.
Yeah.
Yeah.
No wonder when you said last week, I was like, when did you
I know it felt that way. So my mouth was saying what my heart was thinking. So Dr. Learning, but the last time I really enjoyed how you explained, you broke down glaucoma. The one that stuck in my memory was when you were explaining blind spots and how peripheral vision and how people should practice those. Can we reiterate how important it is, the knowledge of glaucoma? How do you explain to a layman?
Okay, glaucoma is a blinding disease. The blindness is irreversible, and most times, because we don't actually have a cause for it, we don't have a cure. So what we have is control. What we have is also a way of stopping further damage at any time the patient presents. And that is why the World Glaucoma Association and the World Glaucoma Patients Association, now they're two different things. World Glaucoma Association is the association of practitioners in glaucoma management. Then we have a patients association. That means there's a group that has come together. They are living with glaucoma. And they find out that the best way to do this is also advocacy. Because for a condition that has no cure, the earlier you make a diagnosis, the better, so that you stop further damage. It is a blinding disease that affects the optic nerve, the nerve that supplies the eye. And there are many theories, many associations as to what conditions have it. Because it is painless, people have it and they don't know they don't realize that it's there. So it's the regular eye checks that help make early diagnosis. And the way it steals your vision is from the periphery. You don't even know because everybody is looking straight ahead and they feel they can see, but from the side, they're losing vision. So unless you go for an expert eye screening or eye check, you may have it and you don't know that you have it. And the associations decided that, look, the best way to do this is to keep educating, and that is why we have this Glaucoma Awareness Week every year.
Yes.
It's been going on for 10 years. I believe we're making an impact.
That's
whenever we can.
beautiful. I mean,
Yes, it is.
for you to have been there for this long means you're doing something right. And for you to have come into the studio with Dr. Samsedi speaks to the fact that you work hand in glove. You all work together to ensure that the awareness spreads as far as possible. It's
That's correct.
It's the first mistake is us assuming that everybody knows what glaucoma is. Dr. Samsedi, how many? I won't ask you how many because statistics can be variable sometimes. But when in your diagnosis, your everyday experience and encounter with people, how often do you see people who know or who come in to consult you, who know that they are coming for glaucoma or probably detects amidst a myriad of cases?
Once again, thank you for having me. And will I say thanks to the chairperson of the OSM for making this happen. Almost 100% of the time, let me just say say 95% of the time, most people who walk into the clinic do not come in because they're coming in to check for glaucoma. They're coming in for one other problem. They're coming in maybe just to have an eye check. Some are coming in maybe to have their glasses changed. Some are coming in because they have a red eye. Some are coming in because they have it beginning to experience blur vision in one aspect, And when they come in and you have your tests done and you discover it in this part of the world, and I'm very particular, it's saying in this part of the world, the reaction you get most of the time can be very, very interesting, very, very, very funny. Many times, doctors have been bound, loosed, cast out because of the quote-unquote negative report coming to them as it is not my portion.
Oh, wow.
That kind of thing. And that's why I said in this
denial.
climate, and it's funny because no matter how you run away from it, the doctor is not the cause of your problem. The doctor is a trained scientist. I like when she said expert screening, because there are a lot of screenings that go on now that are just for monetary gains. They are not really targeted in your best interest. No. So when you come in for an exam and you're having a comprehensive examination and the doctor realizes, something might be wrong here, which as we go along, they're going to describe, the different kinds of tests and things like that. It's the onus is on us, like she said, advocacy over 10 years, and it's ongoing to make people know that, look, when a doctor says, this is what I see, this is what I suspect, or this is what I confirm, it's in your best interest to now say, what we do about it. From a definition, you see that there is no cure. It can only be managed. But you see, that management comes with the cooperation of the patient. Like now, you see, in civilized climes, you see, he said they have the Glaucoma Patients Association. Now, they've created something like that, but it's not very strong yet, because you see, when you classify people into that kind of association here, they will say, so you want to tell me that I have signed up for blindness? That's the way they see it. Do you understand what I'm saying? So, and an ongoing awareness campaign where, they can make people understand that, look, each practitioner has been trained to detect these anomalies, these problems, and we let you know in cases where you need to refer. We refer, for expert management. But the truth is, we need expert compliance as well.
And I like
It's
that.
good.
I like that.
Can I say that in Nigeria we do have a glaucoma society and comprised of patients.
Mm.
The whole idea is for support. They support one another. They encourage one another because they can be failures, what people call failure. Continue to go blind. But then you get the ones that are success stories as well.
Yeah.
The ones that checked in early, the ones that have brought in their families and their offsprings because they were told, because you have it, you need to check your offsprings. The ones that have been compliant with all the advice that the doctors have given them. They are all in that society. And so they too help us with awareness and with progress. So we're making progress. 10 years, it's not been any joke.
Yeah.
But one day maybe we'll have some of the members of the society on this show to talk about their experience
That
as
would
well.
actually be very good.
We
Very
will.
good.
They are happy to share their experience.
I like that exists. The
We do
support
have.
system.
Yes.
People sharing from experience.
Yes.
And I like that you mentioned, Dr. Sam said, you mentioned the scourge, the way people look at it like it's giving you, it's already putting you in the category of society, which shouldn't be.
Yeah.
And
All right.
also,
So I was just going to
yeah.
say that we talked about the Glaucoma Awareness Week, and that is just to mention it starts from Sunday the 8th of March all
Yes.
through to Saturday
To
14th
Saturday
of March.
14th,
So
yes.
each year so there'll be a number of activities around this, and this is one of the free activities during and of course post. I know that we understand that glaucoma is one of the leading causes of blindness for people over 60 years around the world. However, it's been also said, and perhaps you'd just confirm and then explain why, if there's an explanation, that Africans are predisposed to having, or have one of the highest numbers of glaucoma. Is this true, and why is that?
It is more prevalent and more more. There's a word for it.
The Africans are more susceptible to it.
No. Apart from the susceptibility,
Yeah.
it
The risk
kind of
factors,
sits
yeah.
stubbornly on African and African Americans.
Why? They love their skin.
Well, we're still studying this.
So
Like I
there's no
said,
reason.
the research into glaucoma has gone right down to the genetic level,
Mhm.
but no solutions yet. The truth of the matter is, because of healthcare delivery in Africa, we will focus more on getting the patients in and getting early diagnosis. Because if you wait for your vision to have gone off 60% of it, and then you now seek advice, it's different from when only 5% has gone.
True.
And then you have the rest of your life living with glaucoma, but treating it and managing it properly. So we don't know the cause. There are so many risk factors.
Right.
So-
Any
yeah.
risk factors
Yes.
above age 40. Black Africans and African Americans is more resilient. It's also like more, it's associated with diabetic patients, hypertensive patients, but it doesn't mean that every hypertensive patient will have glaucoma.
All right.
Just that it's not surprise if we find glaucoma in hypertensive patients and diabetic patients. If you are really short-sighted, high myopia, you tend to have it. If the smoking, alcohol, all are associated factors. So even as we all sit here, you can count the risk factors that we have. If I'm over 40, and I am, that's one. I'm African. I'm African, yes. Well, I'm not diabetic, and I'm not. So what I'm saying is that it's not impossible for people to actually have it and not know. We call it the silent thief of sight. Painless, insidious, gradual loss of vision. You don't even realize.
Which is why the theme, I think I understand the theme is the same as last year's, Beat Invisible Glaucoma, the big BIG.
BIG,
you mentioned.
big.
Let's take a break. We'll be back. The topic is just looking at how to beat invisible glaucoma. Send us messages on WhatsApp 0809-444-0981. Our studio guest, Dr. Olorinimbe, Modupe Olorinimbe, the chairperson, Lagos State branch of the Ophthalmology Society of Nigeria, and Dr. John Samsedi, who's the chairman of the Lagos State branch of Nigerian Optometrist Association.
98.1.
This is
Sorry,
smooth.
I know you're quite warm.
Yeah, I can't remember it being like this though.
Yes, it's
a new
not
thing.
it's not always like this.
Okay.
Yeah.
You see, when we set out to do banking, we didn't just want to do the usual.
Someone come
We
back,
wanted
we'll
to
look
do
at treatment.
different.
Diagnosis.
Touch on myths again.
Before then, also, I'd like to ask Dr. John how often people should go for eye checks, because I don't think we are yet in a nation that promotes even our health checks, general health checks. People don't do that because you would rather not know that something is wrong. You know, we like to live in denial. But what would be the recommended number of times, and at what age? So I know at different age points, go maybe if you're under 40, go once in 2 years. I'm
And
just
how much
saying
does this
because-
test cost?
okay.
Can you say how much it costs?
For the test,
Mm.
it's going to vary across border because you have the
general
public,
Yeah.
and then you have you coming on air to mention
no.
costs
No,
is
but I mean, we can only
usually
talk based on the government hospitals.
Oh, okay,
I think
okay.
those are
Yeah.
for the public, so everybody.
But
actually
basically,
has-
for the government hospitals, I know it's very, very, very affordable because having to access a doctor in the general hospital, I think, is way affordable, you know, and it's just for a matter of getting the systems to be more effective.
Okay, we're
Yeah.
back.
Yeah.
Please move on.
Those are the public hospital one.
Okay.
Lagos Talk 91 here on Smooth 98.1. It is our final segment of For Smooth Breakfast. I'm Ayon Myro Essing.
And I'm Valentine Ohu. Good morning.
Today the focus is on glaucoma. Next week, or from Sunday the 8th of March 2020, is where the World Glaucoma Week, and throughout different parts of the world, awareness raising, talks about this, and just generally understanding what this condition is, and hopefully preventing incidences of this, or what would call the silent thief of sight from taking its hold. To join our conversation this morning, we have Dr. Modupe Olorinimbe, who is the chairperson, Lagos State branch of the Ophthalmological Society of Nigeria, and we have Dr. John Samsidi, who is the chairman of the Lagos State branch of Nigerian Optometrists Association. So I dare say that we have the best of the best with us speaking on this topic. Before the break, we talked about people who are predisposed to have it, not predisposed, but people who are more at risk at having glaucoma. We talked about some of the risk factors, and of course we broke it down as to what is glaucoma. Now, in terms of checking and early detection, which is key, because as you've mentioned, thus far the level of, or the amount of research that's gone into this, there's no cure that has been found for glaucoma. However, it can be managed, and the earlier it's detected, the better it can be managed, so that it doesn't have to lead to blindness. Now, one of the challenges that we might face with regards to detecting early is even having your eyes checked, because like you mentioned, Dr. Olonimbe, it's painless. You might have it and you don't really know that it's a silent thief, like you said. So how often would you advise people to go for eye checks? I'll ask Dr. John, please.
Okay, thank you. It is absolutely important that we have it as part of our plans, as part of our routine medical checks generally, because it's something that most people don't put into their planning, people don't put into their budgeting,
Very true.
and that is why there is always this cry of, when you talk about the frequency, most of the time people are like, but accessing eye care or medical care is very expensive, and that's the first thing you hear. But when you turn the tables around, you see that they just have their priorities all warped. So I will say, like Dr. Olorunibos rightly said, the risk factors starts from 40 years. Arguably, some people will even say 35, okay, because you have different classes and different classifications. For glaucoma, I mean, you have children, and like she will explain further, and congenital glaucoma. So I would say, if we were to break it down, not just limiting it to glaucoma alone, you want to say there are landmark ages. So I would say the preschool age, and that's why one of the things, as an association, we've been trying to lobby is to see how they could make it like a right for a child to have access to maybe like free eye exams, at those very sensitive ages, because they are one of the most vulnerable when it comes to healthcare, because there are many parents who feel their children, they cannot, that's what they think, they cannot have eye problem. They are too young. What do you mean? It's too young. to have an eye problem? Why would my child have a surgery? Why would my child wear glasses? I mean, and it's a myth, you understand? Because like I said, just like that child can breathe, that child can be susceptible to all kinds of diseases. So there are landmarks when that child is preschool age, okay, and then maybe when he gets to about 6, and then like she said, when, we normally advise on a general note once in 2 years. Now, if that case, as you grow older, we expect it to become more frequent. We expect it to become more frequent. So normally we even advise on a general note when you're above 30, 35, every year, have your eyes examined. But when you are diagnosed with glaucoma or you are a suspect for glaucoma, now that is no longer in your decision. The doctor should be the one to determine the frequency, because based on the findings, based on the test reports, loads of tests that are available now, for management and detection of and treatment of glaucoma, the doctor will be able to tell you, okay, for you, you need to come in every month, because there are some times where you have drug fails, surgical fails, and they need to monitor. So you can't do this at home, because now most times, in fact, what most viewers will be waiting is, just tell me the magic drug, the magic one that I will take, and then I would be able to do this at home. No, this is not a do this at home kind of disease. You need to work with your doctor.
I like how you said no DIY solution to this.
Yeah.
And also stating that, you know how you made allusions to parents, understanding the myths around it so that they can demystify the issue of glaucoma and be able to educate their kids, or, debunk all these superstitious beliefs they have. Also, I remember when I was younger, when I was younger, it was a very attractive thing to have glasses on. At that time, I think when I was in secondary school, I used to admire my friends that wear glasses. So imagine a young man at that age glorifying, eye problems. A lot of kids these days still look at it as an attractive thing because you're regarded as an intelligent person by default. How much knowledge do you think is lacking on the part of kids, especially coming from schools? How much knowledge should trickle down to schools for teachers in secondary, primary schools, for the issue of glaucoma to be spread, for the knowledge of it?
Quite a bit of awareness is already with primary school teachers. Maybe not for glaucoma, but when a teacher suspects that a child is not doing well because he's not writing fast enough or he's not learning fast enough, they normally tell the parents that, oh, maybe you should have his eye checked. So a lot of teachers do that already. But what Dr. Sam said is saying is, what we want is by the time a child is 6 years old, at least once the eye specialist should have assessed that child. From 6 till secondary school, in this situation, when children are born, other doctors come and check. But everybody forgets that these 2 little organs, the eyes, need to be checked as well. We are hardly called to just to look. Can this child see? Is there a white reflex? What kind of reflex is shining out of the eye? Because you can detect all sorts of other conditions. Between 6 and the teenage years, you can do 2 years. When they get into secondary school, everybody fills a form. Can you remember? A pre-assessment form. But people generally till today, they just fix whatever. Oh, he's seeing well. What did I write here? 6, finish. That child might not be seeing well. By the time a child is old enough to say for himself, oh, I think I'm not seeing as well as my other. He himself takes the initiative and he complains. But by the time we're like, you see, the books say 40 and above is a risk factor for annual checks, for glaucoma, so that you can have annual checks. But with glaucoma, there's no fixed rule. It is true they said 40, but I've seen glaucoma in a 25-year-old.
Yes, I met someone who was diagnosed at quite an early age, and I was quite surprised.
So that person may have what we call developmental glaucoma. Maybe not congenital, but over the years. Then there's the congenital variety. There's a classification for glaucoma, different classifications depending on what you're using as your base. So the best thing is for people who are listening now, don't even overthink this issue. Just go for your eye checks. If you want to remember, choose your birth month or your birth date. Your birthday, you may be too busy celebrating, but choose your month and say, in my month every year, I'll have my eyes checked. It's a bit easy to remind yourself. And then where do you go? You can go to the private. It's your choice actually. You can come to the um, public hospitals.
Yes.
The public hospitals, I'm sure somebody is going to ask about cost. How low can you get? Whatever you get to pay in the public hospitals is far lower than whatever you'll get in the private hospitals. And now there are standard tests that even the public hospitals provide and the private hospitals provide as well. So, what is our excuse? The only thing is, I know people will say, oh, when you go to the public hospitals, you spend the whole day there.
Mhm.
Yes, because of the crowd. But you can't complain about spending a whole day somewhere if you are getting results.
Absolutely. Yeah.
Doctor,
Take a book. Get ready. Know you're going to
Yes.
spend your day for
Pack
it.
your
That's
lunch.
good. Yeah,
a
exactly.
quick question for Dr. Samson before we go to the messages. How long does it take for diagnosing a glaucoma case?
It depends. It usually depends on what we find as we make progress. Because, like she talked briefly about the tests, there are an array of tests, like their standard tests. You want to expect maybe there are more sophisticated, devices nowadays, but the standard test, even in the general hospitals, the public hospitals, is at least an ophthalmoscopy exam, of course, after the basic vision screening exam. Now, I also want to say something quickly. There are the vision corridors. Lagos State government, kudos to the administrations past that have made it possible so that teachers, there's this training of teachers we do from time to time to help identify children that have problems with their vision. But the truth is, the fact that a child has, or an individual has 6/6 vision does not mean he doesn't have glaucoma. Okay? Visual acuity tests, passing the visual acuity test does not amount to passing the glaucoma test. And that's why she said standard tests, not one test. So it will take a while sometimes, for instance, there's what we call a suspicious disc. Suspicious disc is a suspicious disc. You cannot, so it could take a day, it could take minutes. So it usually depends on the providers at that time to be able to determine. You want to say something?
Yeah, Cruz has a question. Sorry, before we get
Okay.
to that. Cruz on WhatsApp says, by the way, that number again for WhatsApp messages.
0809 444 is the number to send your message to.
Cruz says, good morning, doctors, educators. Are there food types that aggravate or encourage the occurrence of glaucoma? I love that he asked this question. Give examples. Agari, fufu, etc. I once heard that fufu, aka loi loi, aka akpu, can give you glaucoma, maybe because it's white, but how true is that?
And then the second part he
Yes.
mentioned, he says, I noticed that when I have a high carbohydrate dinner, my first few seconds after I wake up is usually with a slightly cloudy vision. Based on that, I stayed away from gari for months. Such meals, in my experience, include white bread, rice, gari meals. So there's some food items or food classes that predispose you to having eye conditions, including glaucoma.
There's no proof of these things, but I'll explain the gari, the fufu thing. The base of gari and fufu is cassava. And in the old days, they were processed in such a way that it contained a high level of cyanide still. And that affected the optic nerve. Glaucoma too is an optic nerve disease. It caused some form of neuropathy. A Nigerian professor, I can't remember his name, actually came up with a paper that, look, if you reduce and you change the way you process this cassava to produce your fufu and to produce your gari, then it's safe. You can have it. You can keep eating it. And I think everybody went on board with that. Now it's safe to take gari. It's not the gari that causes we don't have the gari that causes the optic neuropathy anymore, the pathology in the optic nerve. The pathology for glaucoma is still yet unknown, but because the same nerve is affected,
Yes.
so I think it's safe to I take gari anyhow.
Casa flakes.
Well, if you want to market it abroad, that's what you call it. Yeah, I take it anyhow. But importantly, this person has said that he notices something in his own body.
Yeah.
I think he should go more than just checking for eye. The eye is a mirror for the body. He could have to do a diabetic screening because he notices that when he takes a high carbohydrate level, by the next morning, he has blurred vision. He should be seeing a physician. We call the eye a mirror to the whole body. Sometimes you look at the eye and you're asking the patient other questions about his body, and he's thinking, Is this person, does this person know what I'm here for? I'm here for my eye.
Yeah.
Why are you asking me if I have diabetes? So he may have to do a general screening for his own health.
All right.
And of course, his eye screening too.
Thank you. We'll have more questions.
Yes, we do. This one, Olumi, this, oh, sorry, no name here, but please put your name. He or she is asking, my dad was diagnosed of glaucoma a long time ago and has been on his medications. However, how often does he need to run his visual field test? That's the question.
Now that the frequency, like I said, will depend on the provider, on the ophthalmologist or whichever professional is handling that. What I normally advise my patients when they come in contact with me is, look, don't assume that, oh, this is the final bus stop. There has to be regular checks. In some cases, the provider will have to say, come do it monthly, till we're able to, establish that this is what you have to do, this is how you have to do it. There are some people, they just give them maybe a particular medication. I'm not going to mention any medication, and they just go with that medication for years. And by the time they come back and you are doing the fields and maybe the OCTs and all that, you're seeing damages. And they're like, but I've been taking this drug. Because there are times where, like I said earlier, there might be some changes in the person's body, acceptance. Like the patient who has the first question, it may have to do with allergies. It may just be reacting to something in that particular food, or so. That's why doctors should be your friends.
Yes.
Doctors should be your friends. Yes, ma'am.
Can I say, can I add to that the whole idea, he said it's not the last bus stop, it's actually a disease of progression. Your success story in glaucoma is if you can arrest that progression. So the tests that you do monitor the progression. Many times when people hear, oh, your pressures have come down, they even stop their drops. They stop taking it. The last time I came, the doctor said my pressures have come down. And their interpretation is, I can stop my drops. The 6 months time when you see them, the vision is almost totally gone. The intraocular pressure is also a risk factor, not necessarily a cause, because there are some people with low intraocular pressures and they still have glaucoma.
How do you tell your level of pressure in your intraocular pressure? You mean
it's measured by an instrument, and
you can't necessarily feel it.
You can't feel it. It doesn't even cause an ache. But many people think, oh, I have an ache. Do you think I feel the pressure in my eye is high? But until you go to a practitioner and the practitioner checks that pressure, you can't honestly say that the pressure in your eye is high. It's painless.
Let's take time to have a breather. Send me your questions on WhatsApp 0809 444 981. Our special guest talking on how to beat invisible glaucoma, which is the focus for this year's week.
Yes, second place from this year's glaucoma week. It starts on 8th of March. That's on Sunday, up until Saturday, the 14th of March.
Dr. Modupe Olorinimbe and Dr. John Samsedi are still here. Smooth 98.1.
Start your day the grown-up way.
Okay.
For the week activity, because of the mic.
Sorry?
We didn't just want to do the usual.
So the camera can catch you.
Okay. Yeah.
Yes.
No? Activities, yes. Yeah, we'll end with that. They have a few more questions on WhatsApp. So we'll end with we even wanted treatment options. I know you talked about drugs, and then some people, because people are asking questions, and this is what we usually have. Maybe parents who have glaucoma and want to just clarify a few things.
So what was this question you asked? The last one.
This last one was about
my
my father being diagnosed visual field test. How
Okay,
long do they
how
take for
long?
the visual field test?
I'll still touch on that.
So no need for music break.
No, because we only have a few more minutes.
Okay, we're back in 6 seconds.
Future Forward Bank.
Lagos Talks 91, Smooth 98.1. I'm Ayo Myro Essay.
And I'm Valentine Ohu. Good morning.
This morning we're speaking to Dr. Olorinimbe, Dr. Modupe Olorinimbe and Dr. John Samsedi, both from I'll get this. Ophthalmological Society of Nigeria and Optometrists Association of Nigeria, respectively. And this morning we're looking at beating invisible glaucoma, which is said to be the silent thief of sight. Did you know that next week, that's from the 8th of March till the 14th of March, is Glaucoma Awareness Week? The number of activities are lined up during this week, and today is one of the things we're doing to raise awareness about this, because early detection is key. And as an African or African American person, you are, it's prevalent amongst this particular race, and so it is important. And if you really check, most of us know one or two people that have been diagnosed with glaucoma, so you know just how common this is. And like we mentioned, it's not a blindness sentence. You can actually manage it properly well if it is detected early. Now we have questions. We'll concentrate more on the questions for this segment before we'll talk about people asking questions, and then we will hopefully discuss some of the activities that have been lined up for Glaucoma Week for this year. We have Topper here saying, good morning. My mom was diagnosed of glaucoma. She has been on different eye drops for years, but she keeps complaining that it is not getting better. What can she do?
Can I say that I hear that a lot. That, doctor, you're giving me all these drugs. They're not exactly cheap, but I'm not getting better. The patient's perception of getting better is to see better. Remember that we said that the blindness is irreversible. The doctor's perception of getting better is that there's no further loss. So that is why we keep saying you need an early detection so that you won't even have a substantial loss in the first place. It is very difficult to expect a patient who feels she's not getting better in spite of spending a lot of money to remain compliant with the drugs. But that is why you need to keep going to see your practitioner. They'll keep encouraging you, and they'll keep telling you, we keep telling them, you are getting better in that you are not getting worse. How do I know you are not getting worse? If you have your regular central visual field tests and any other test, gonioscopy, everything that the practitioner wants to do just to keep monitoring. It's a very frustrating condition to have.
Yes.
Yeah, a little good.
Yeah, as a little question, a leading question from what you just said. Is there a timeline for glaucoma progression from when it's first detected to maybe at a particular threshold where you can actually cure it, and then if it goes beyond that time, it's incurable? Is there something like that?
No, you use the word cure. That's also a wrong
It's
word.
not-
At any time it is diagnosed.
I'm just hopeful.
Yeah, we are all hopeful. At any time it is diagnosed, what we have is control. So if only 5% of your vision is lost, we're controlling 95% to remain there. If already 50% is gone, we're trying to control the 50% you have left to preserve it. So what we say is there's really no cure. And that is why it's a lifelong
Management. Yeah.
management and a teamwork. You need to team up with your practitioner. You need to, but people hop from, I notice people hop from doctor to doctor. That one is not controlling it. But it depends on a lot of things. It depends on how regular, how compliant you are with your drugs, how your own constitution is, and what your other underlying medical conditions are. So the aggression with which we practice and manage glaucoma differs from individual to individual. But many people are winning.
Okay.
I have a very good question from Martin. Sorry, Dr. John, from Amod. We have a number, so I'm trying to rush through them because we have a short time. He says, I have a neighbor whose child of 8 has glaucoma and was placed on brimonidine. I hope I got that right.
Yes.
But after using these drops, it makes her to sleep all through the day. Does it mean that it's affecting the brain cells?
Different drugs for and the way they respond to the treatment plans. Whatever the ophthalmologist or eye care provider must have dispensed that brimonidine must have his or her reason. There are some times where they use a particular medication and is not giving the doctor the desired result, because the truth is, once you place a patient on a particular drug, you want to check to make sure, because they are target pressure readings. So for instance, let me use the word, say someone comes in at 30 millimeters of mercury, because I think she mentioned earlier the expected pressure reading sometimes is between 910 to 19, 21. For me, I always say 19 because sometimes now patients are becoming very smart. They want to know what's the pressure reading,
As
just
you're
like their
talking,
BP.
they're
They're
Googling
looking,
it.
they're
It's on the
Googling, you
table.
know, everybody's a doctor for his own life because of their phones, their handsets and everything. So the doctors are very careful, you know, because it's an information age now. You don't just do anything and get away with it. But the tests, they help. You know, she mentioned the test of the gonioscope. I mentioned the OCT. All this, and really, to be very truthful, managing glaucoma could be very, very expensive. In fact, one of my chiefs then said it's a big man's disease. But what she was just trying to say is that you need to tighten your seatbelt. Now, going back to that question, people react to drugs differently. Someone could take a paracetamol and sleep all day. People react. So it's left for the eye care provider at that time to be able to determine, is it wise for me to take this person off this since it's making this child sleep, or do I need to change strategy, or do I need to maybe add something on or take this off? Because I've seen a particular patient, though this is an elderly patient, when you give him that particular brimonidine, it's the best. In fact, it brings his pressure down beautifully, but his eyes get bloodshot red, hyperemia and things like that. But he wasn't satisfied. He traveled abroad and it was the same thing. You understand? So all he needs to do, or that person needs to do, is work hand in hand with the eye care provider to see how they can make it work. Because like she said, the goal is to make sure blindness is halted. Because the truth is, if you leave it, definitely the person will lose his or her sight.
Thank you. So the two key statements, two key facts to take from that, from your answers. No, there's no drug as one size fits all.
Can I say something?
And say no to self-medication.
There are different modalities for the management of glaucoma. And there's the surgical aspect, there's the laser aspect, and there's the medical aspect. Usually, this person says there's a child with glaucoma. Practitioners would actually go for surgery in that child. So I don't know if that child has had surgery and then placed on brimonidine, or if it's straightforward brimonidine. Because in the child, it's probably congenital. That means there's a malformation of some structures in the eye. Drugs won't correct the malformation. You might have to see an ophthalmologist to do a surgery, or decide if it's laser or something. I'm not faulting the management, but I'm just saying that also you can have surgery and still have to go back on drugs. Whatever drugs you are giving, there's always side effects. And you know, we just have to either live with them or and manage.
Interesting guy, this glaucoma person. Let's take a break. We'll be back with more of your messages. Stay with us.
Sorry, just want to quickly ask, because what I wanted to add the other time before the question came in was, many patients think that when they come
I
in,
want to just summarize most of the questions.
they think that glasses is part of the treatment for glaucoma. So I want to address that now.
Yes,
Glasses cannot.
I'll ask because I'm
Very
trying to
important.
summarize
That's why I wanted to
the
add before the question came in.
Okay.
They should understand that if they go somewhere and they have and the end treatment is glasses, they should fault.
So how about shade?
No, glasses.
Shades are type of glasses.
I'm about to cry.
No, they don't.
What?
In fact, that's a good question you just asked.
Usually we address those questions about shades and all during World Sight Day. We're trying to narrow this to glaucoma. If not, a lot of questions that come from shades, the different nano protection from shade, and it doesn't. But you have.
No, she doesn't.
So those are two different.
He uses medication, goes back to NSC.
So he's handling glaucoma on one hand.
People can have glaucoma and have other issues.
Okay.
Yes, people can.
My brother, he recently discovered he had glaucoma, so he had to go for management screening.
Yeah.
He uses glasses for more than 30 years.
Yeah. So glasses does not predict. So what we're just trying to make them understand is, yes, you've been diagnosed with glaucoma. Beautiful. You may have other problems. The person may even have a cataract. The person may even have a degeneration somewhere, and may also have a refractive error. Refractive errors is where
you have coexisting conditions.
And concerning that commonly told one that your glasses have gotten weak.
No, that's true. No. That one-
Is it true?
It's not.
Because I've
It's not
heard
related to
it's not true.
glaucoma, but glasses actually lose their
Yes,
potent.
it could, and the reason is this:
Okay.
for glasses, that's not the main topic for now. Is the care, wear and tear that comes with the glasses, and then also as your body evolves, there might be times where you need to upgrade. Okay, but I'm always very careful
That's
when
my
in
story
terms of
right now.
upgrade, because sometimes, for instance, for myopic patients, if the upgrade is rather in quick successions, that may be another problem on its own. That may be another problem on its own. So that's why we have to be
Compounding the
careful. When you say my glasses are weak, I want to change them. My glasses are weak.
I asked that because I think I've heard an optometrist say that it is not exactly so because you cannot see your glasses got weak. There is a probability that it's just your eyes that got bad or got worse.
But you're getting older.
Getting
Yeah.
older.
Yeah.
A better, nicer
Yes,
term to
nicer
put
way.
it.
Yeah.
Not-
Yes.
don't tell me-
Okay.
we try to be quite careful with how you, because the glaucoma patient will always misunderstand you. If you sit down and give a 15-minute lecture and you ask in 3 months' time, what did I
Yeah.
say to you? You'll be surprised. That was the
My dad
person
is
return.
partially blind because of that.
So that means you mentioned your brother and your dad. So there's a family.
But Valentine,
Yeah.
I've told you like 3 years ago that you should be screening your eyes.
Why are you looking at me? Are
Have
you
you
not?
gone for a
I haven't
glasses?
gone.
It changes
Baba,
its
And
So yes, the conversation is so interesting on YouTube. You need to go watch because that's where you get behind the scenes conversations. It's good, and then you can actually catch up on the show. Any parts that you missed after this segment, go back to YouTube. Please subscribe to our channel. Type Smooth 91 FM Lagos and watch.
Yes, indeed. We are rounding off the conversation this morning on beating the invincible glaucoma, and Dr. Modupo Olorunmimbe and Dr. John Samsedi are here with us. And a few comments have come in through WhatsApp. I'll try to run through them so that we can answer them in the last few minutes that we have, or at least respond to them where possible. Unfortunately, we cannot take all the questions, but I'm sure our doctors will give you their details before the end of the show so you can contact them privately. Someone says that they had malaria, and so would malaria be said to be could predispose someone to having eye issues or glaucoma in this case? Another person is asking about computer and phone usage. Radiation from these things, can they be a risk factor for glaucoma? And then Bamdele said that he or she was diagnosed and said he required surgery but ran away. And what can be done now? So I think you kind of answered that with the previous one, that the earlier you manage it, the better. So I hope he's listening and you don't run away and just face it. But yes, please, some of the things, some of the myths that some people want to debunk.
So use of phones and computers.
Well, they cause other things. There's no proof that they cause glaucoma. We're talking glaucoma this week.
Yes.
Yeah. But you can have eye strain, you can have computer vision syndrome, and all of that thing coming in from the glare of your phone, the glare of your computer, and there's management for all of those kind of eye complaints. But that the glaucoma, no. Bandele, if your doctor says you need surgery, there must be a reason for it. See, there's no harm in having conversations with your doctor. If your doctor says something, most doctors would like you to ask questions back so that they can explain the reason why they're going for that modality. It could be that the stage at which you presented, they're thinking, this pressure is so high, I need to bring it down. Medicine drops won't bring it down. And then you can have your surgery and continue with medication. It depends on what you present with. But I must say that the surgery does not bring back the vision that is gone. The surgery is meant to stop further damage, just like the eye drops, just like laser. So when people go for surgery, they are actually expecting that in a few days, they should be able to see better. So we have to explain that to them.
You're not getting your eye replaced.
Okay. Let me add this. Yeah, sorry, man. Let me add this. It may be very lame to the professional listening, but to the patient, it may be very helpful. I usually describe glaucoma to my patients as an armed robber. Okay, that has come to steal sight. Now, this armed robber is very skillful. And when he comes, it comes unannounced. It doesn't make noise. Like, there's this rat bite in those days that when it bites the foot,
Yeah.
it blows.
With the pointed
So
mouth.
while you're sleeping, it even makes you enjoy the sleep better. But when you wake up and you put your foot on the ground, you feel the pain. Now, to be able to make the person understand what glaucoma is when this armed robber steals, let's say there's 100,000 in the account. If he steals 30,000, most likely that 30,000 naira, you cannot get it back. No EFCC can recover that. The FCC now is the ophthalmologist, the optometrist, and things like that. Now, the job of the EFCC and the doctors in this case is to make sure the remaining 70,000 is safe.
I love that analogy.
Yes.
And talking about malaria and other illnesses, does it predispose you?
No, but malaria, the symptoms of malaria can cause blurred vision. Even the side effects of some anti-malarial medication will cause blurred vision, but that doesn't mean that you have glaucoma.
Okay.
They
And
should
it's
also
not permanent. It's once you over the malaria, it goes.
Thank you. One of the questions we had, I don't remember your name, or you didn't put your name here. He said a follow-up question. He said the doctor also insisted everyone in the family get tested. I have had mine, but for second opinion, how often do I need to go for further screening?
Such a person should go annually, because the fact that you are told today that, oh, you have an all clear, you don't have glaucoma, but it's in the family, it's in the strain. I mean, you better be going every year. Just choose your birth month.
All right.
And like we discussed, I wanted to introduce this quickly. Most times you hear people say they were diagnosed with glaucoma and they were given glasses. And I cringe, because the truth is glasses do not cure glaucoma. Glasses deal with something else, refractive error conditions.
Yes.
Glasses do not solve the glaucoma problem. Glaucoma is not a myth. Glaucoma is a real life issue. And please, just like we've been talking about this interesting conversation, have your eyes checked comprehensively, expertly.
Thank you, Dr. Lorinimbe.
Thank you so much.
Final statements?
Well, glaucoma is the silent thief of sight. The theme is beat invisible glaucoma, because it's not something palpable, and that is what we're asking. For so many years, we've been advocating that the patient takes responsibility for their eye health as well. Do not wait for something bad to happen before you get your eyes screened.
Brilliant. Now, how can people get in touch with you? You're on social media, email?
Twitter.
Well, it's okay not to have. No? You can send us a message. That's fine. All right. So you wait for the next time they come, or you visit them?
No. Well,
We do an email address.
Yes.
It's an association email address, so we can
Yes.
throw the questions, and that's what we do. We have a pool of trained professionals that can handle this. You have the noalagos@gmail.com.
All right.
noalagos@gmail.com.
Yeah.
We have Lagos OSN. One word, Lagos, LAGOSN
Okay.
at yahoo.com.
All right.
All right. Thank you so much, Lagos. It's been a great conversation this morning. It's been enlightening. And yes, activities very quickly for Glaucoma Week, World Glaucoma Week in Nigeria.
Okay, quickly, let me say that this year we're having to take a different
Approach.
In the past years, we had eye screenings all over the place. But this year, because of the protocol set up for coronavirus prevention, we're not able to gather crowds.
Exactly.
So we're not having eye screenings on a massive scale this year. But we have a symposium on Wednesday, the 11th of March at the Eye Foundation Hospital. That symposium is open to anybody. It's not only for the professionals. We want people living with glaucoma to come, and then we'll be able to talk and answer questions on glaucoma and suggest solutions to what some people may have.
What time does it start?
It starts at 9 a.m.
9. So for those who had questions we couldn't answer, this is a brilliant
way to get
your answers to questions, or some things that you have, some unanswered questions you have around glaucoma. Thank you so much for sharing that.
Thank you.
Thank you, Dr. Modupe Lorinimbe. Dr. John Samsedi, thank you.
Thank you very much
We are glad
for
to
having
have
us.
had you join us on the show, and everyone who's listening and you've sent in messages, we thank you. We encourage you to tune in again same time tomorrow, 6 a.m. for Smooth Breakfast with me, Valentine Ohu.
And Ayomiro Essay.
Thank you.
You listen to Myro.
Yes,
The
sir.
singer.
Yeah.
He's admiring.
I'm sure
Oh, so he
This is
sings
his
to
wife and
you.
manager.
Can you imagine? I listen to